So if there is any genetical abnormality, so passing through the generations in some family, so they don't want to get it to the upcoming generations, so can they do anything through IVF or ICSI procedure to prevent that from transferring into the next generation?
Yeah, one thing is like recently for genetic abnormality, we used to do pre-implantation genetic diagnosis. That is only for not for sex determination, only for genetic contributions, anything that to be noted. And that if it was in family, people used to know sometimes, or else some repeated implantation failure, or for like miscarriages or advanced maternal age also, like we used to do some PGT. Either they'll go for karyotyping first, the couple will undergo karyotyping. So if they have any abnormality or nothing, like we'll be knowing, coming to know, then later they'll be going for embryo biopsy, polar body biopsy, and lot many advanced techniques has come in genetic field also, like mitochondrial transfer and spindle transfer, all many techniques has come.
So during the embryo development, like on you are checking on day 1, day 3 and day 5, so there will be number of cases you are performing every single day. So while checking these gametes, you should not disturb the other gametes which are going through the other process. So how do you manage that in all those incubators?
Yeah, this we have like 3 different incubators. One is working incubator, which is CO2 incubator. The other one is the MINC, which is humidified incubator. The other one is G185. This is a dry incubator. This G185 is the most advanced incubator, and that is like it has different chambers, like separate chambers. Nearly 10 chambers they have. Total 11 chambers we have. In 10 chambers we can culture the embryos. So in that case, like we won't be mostly we'll be keeping the same day cases together. Maximum 2 dishes can be kept in a chamber. So the same day cases can be kept, or if a patient has too many oocytes or something, like we'll be separating into 2 dishes. Like more than 15 to 20 oocytes if they got, we used to put it in a different dish. So same day cases only we'll be keeping in a chamber, and the infected cases and all will be culturing in a different incubator. So to avoid the disturbance for the other gametes, like if it is we used to take, if it is 2 different cases on 2 different days and we don't have any space otherwise to culture, like we used to take out the dish, keep it in our CO2 incubator, which is considered as working incubator. From there we used to check everything, and at last we'll put it back. That we won't open often. That will affect the development.
Every time you are not going to get the perfect embryo and the perfect sperm. Sometimes you will be getting the poor quality sperm or poor quality embryo. So in such cases, is there a chance of getting the best embryo and the positive response and the future baby also?
Yeah, like it is not like oocyte itself has the autocorrection system. So it may look morphologically poor, and we don't know about the genetic contribution. It might be sound, genetic contribution might be sound, and oocyte might look very perfect also under the microscope, but it may have some genetic defect also. So that cannot be predicted. Like our main work is like we have to do whatever the gametes we get. So even the poor quality oocytes, we used to get good embryos, and we used to get positive, and even the take home baby.
So it's all a miracle. So we don't know what might going to happen.
Yeah.
So there will be some cases in which you will get a perfect eggs, but the growth will be very slow, like slow growing, like till 5th day it might not be developed into the breast. So in such cases, what will you do?
We can do only till ICSI part. Like we have to give the after ICSI we have to give the good culture environment. That's it. Like the thing is, one thing is maybe the genetic contribution. Like first, like from day 0 to day 3, the oocyte will take care of oocyte genome will take care of the development, and from day 3 to day 5, the both embryonic genome, that is the mother and the father's, both oocyte and sperm's genome only will take care of the development. So our main duty is like to select the good sperm in either way, like we can use microfluidics, or we should have done like DFA test previously before ICSI. Microfluidics, Zymot of Pixie dish. This all will help us in selecting the high density, like good positive best quality sperms. So that may help in developing a good number of blasts.